On today's All Things Heart, we share remarkable stories from patients benefiting from the newest and best cardiology care right here at the University of Kansas Health System, as tomorrow is World Heart Day.
From the University of Kansas Health System.
I am amazed. The team here is great.
I came on a Tuesday, and then by Saturday I had a heart in me.
I have never seen a group of people work together so good as this team of heart specialists. I mean, it's just unreal.
Stand by to set up show.
And the Dolph C. Simons Jr. Family Broadcast Studio.
Roll it.
Always makes you feel like you're the most important patient on the planet.
I felt heard, and that was really big.
This is All Things Heart.
Good morning. I'm Alexis Del Cid. Welcome back to All Things Heart. Right now, 30 million Americans have heart disease. It is the leading cause of death in the United States for both men and women. But we are making progress with new treatments, research, and later in the program, we're sharing the best advice from top doctors on how to care for your heart and avoid problems before they develop. And we're also sharing some delicious and simple heart-healthy recipes to get you ready for the fall. As always, we love answering your questions. Make sure you send them to us on YouTube, Facebook, the All Things Heart email. You can also send us on the X platform. We're everywhere, and it's right there on your screen. Today, just ahead of World Heart Day, we have a great panel of guests to share their expertise and their stories. We're joined by Dr. Mark Wiley, who's the Division Chief of Cardiovascular Medicine here at the health system. We also have heart transplant patient Carol Barnett and patient Sean Tiener, who underwent treatment for aortic stenosis. Thank you all for being here. Thanks for making time to join us, Dr. Wiley.
Thank you.
Carol, I want to start with you because you had a heart transplant and you had it during COVID. What was that like?
It was very surreal. My husband, there he is, Tom, he dropped me off in the hallway and then had to leave. And I saw him once when a friend snuck him in one night, and I saw him another time the morning of my surgery, and then not again until I left the hospital. I will tell you though, the nurses and the doctors were unbelievable. I say that the doctors saved my heart and the nurses saved my soul.
Oh my gosh, that's wonderful. And that's just really beautiful the way you put that, Carol. And your journey to this heart transplant, though, began 30 years ago, really. What were you diagnosed with and what were the symptoms?
I was diagnosed with a condition called ARVD, and I'd been a runner for several years, and it really all began when my heart raced out of control. I spent 3 weeks in the hospital. This was 3 weeks in the hospital, and 2 weeks after that, when I was released, is when Tom and I got married. So again, it was just another
oh my gosh,
crazy time. But it all started with a
racing heart,
rapid beating heart that I couldn't slow down.
So are you back to running? And you were also an avid traveler as well. Are you back to doing everything you were doing before?
I wish I were. I wish I were back to running. My knee is now my biggest Achilles heel. But Tom and I continue to travel. In fact, we went scuba diving this summer in the Red Sea in Egypt.
Oh, that's incredible. Yeah. So you're back.
Back to very normal life. When I had my appointment with Dr. Roldan 6 months ago, she asked me how I was doing. I said, well, Dr. Roldan, today I did 144 push-ups for my toes. Do you have any questions? And that kind of was the end of that conversation.
That's a good conversation, Andrew. I want to talk to Dr. Wiley now. I want to bring you in. Carol was diagnosed with ARVD. What's ARVD?
Yeah, so ARVD, it's a very uncommon genetic inherited condition. You know, the heart has 4 chambers. One of the bottom chambers on the right side, called the right ventricle, is affected in ARVD. Individuals who have ARVD tend to have heart rhythm problems that can be life-threatening. You know, there are certainly situations where athletes, soccer players, that sort of thing, you know, have their initial presentation of ARVD in that setting. So and it's usually not a good outcome. So that, it sounds like you were managed for quite some time, probably for the rhythm issues, and then ultimately heart transplant, which is really, an awesome thing. So, that's now behind you, and you have a whole new lease on life here.
Does everybody with this condition need a transplant eventually?
No, not usually. Most of them have an ICD or a defibrillator, so they'll have something to protect them from some of those life-threatening rhythms, and then we manage them and kind of have them avoid strenuous activities, that sort of thing.
But hers was genetic. There's nothing she could have done.
No, this is nothing she did at all. It's just, it was kind of her lot.
Well, your lot, the cards you were dealt. You've played them well, though. Looks like you're living and thriving now, Carol. I want to go to Sean now. Sean, you've had a few issues with your heart over the years. We've interviewed you before about these. Tell us about your first procedure to replace your heart valve.
Yeah, so in 2011, I was diagnosed with a aortic aneurysm. It was found by accident, and I spent about 4 days in the hospital. They replaced it on a Monday, and I went home on a Thursday. So Dr. Tripp Zorn took care of me on that one. And it was scary. It was scary to find out that you have this dangerous aneurysm on your heart that can cause you to bleed out and lose your life. And it was really amazing to go through the process of being there at KU Med and having folks help you through it. And it was scary, but at the same time, getting it found saved my life. So thanks to all the docs and everybody who worked to get that and make that happen.
And Sean, you were also affected by the pandemic, except you were affected in a way so many of us can relate to, because you were supposed to check up on that replacement after 9 years, and that 9-year mark hit in 2020.
It sure did, and I did not go, and I knew I wasn't feeling super great, and I missed a few appointments, and it was just amazing. I was like, oh, it's just stress, and I was under a lot of stress, work stress, life stress, and when I look back on it, and with my first aneurysm, or my aneurysm, and then the valve replacement, it was interesting because I felt really tired, and I felt tired for a good year. And on this occasion, once again, I felt really tired, and I was worn out, and I couldn't even do normal activities like walking 3 miles. My ankles would swell. And
Jeez.
I just didn't feel like I needed to get to the doctor. I was like, yeah, I don't have COVID. I'm great. And it turns out I was just suffering from my valve not working properly.
That must make you cringe, Dr. Wiley. I mean, this is so common. I put off doctor's appointments. Pretty much everyone we speak to put off some sort of doctor's appointment because they were afraid, because it was COVID.
Yeah.
What's your reaction to that?
Well, we really saw so much of that during COVID, right? So when COVID was at its peak, I think we can all remember back, there was so much uncertainty. You didn't know how sick people were going to get.
Right.
You didn't know how contagious. You were afraid of pretty much everywhere you went. One of the places that got sacrificed is the doctor's office, because people would feel okay, but not great, and they kind of make that decision, let's just put this off. I'll come in when things kind of settle out. COVID's going to go away. And so we had a kind of a drop. We did a lot of telehealth, but we had a drop in office visits. We had a drop in acute patient presentation at the beginning, and then we had this rebound where we started to see a lot of sick patients that were really complicated, and sometimes were beyond the point where we could actually be beneficial. So, I totally understand how that happens. And that was a very challenging thing. I think a lot of us will look back at that and, have a lot of memory as to why things happen. And, maybe if we ever were in that situation again, have a different plan or different approach. But, I didn't see my primary care during COVID.
Even,
and I thought I felt fine. I was fine. But I understand it. Yeah, no, I didn't see a dentist for probably 2 years.
Because it was scary. You have a mask on. Your teeth didn't fall out. Still got a good smile.
I don't think.
Sean, what condition was your valve in by the time you did come in and see the doctor?
I believe, if I remember the numbers correctly, about 40% of the fluid that was pumping out of my heart was going back in.
Oh, geez. And you're an avid to call you a cyclist wouldn't even do justice. You do these monster bicycle races where you're riding hundreds of miles. So for you to not feel well, it really must be something. Dr. Wiley, I want to ask you about aortic stenosis, which is something that Sean had. What is that?
Yeah, so aortic stenosis is a condition where the aortic valve, normally the aortic valve is kind of your last main, one-way check valve. So when the heart pumps and squeezes blood out to the body, your aortic valve opens and then shuts, right? Normally it opens about the size of, I would say, a silver dollar. So 4 centimeters squared, about the size of a silver dollar. Aortic stenosis is when those leaflets become thickened or calcified, and they just don't open like they should. When it becomes severe, I've seen patients, it's the size of a pencil eraser.
Oh, man.
So it's just that last checkpoint that's supposed to open up freely becomes restricted, and it puts a lot of pressure on the inside of the heart, which makes you short of breath, and it can be life-threatening.
So if he was to just have it go untreated at all?
Yeah, well, it's a gradual decline, and then once you become symptomatic with aortic stenosis, the survival actually drops off. It's about 50% at 2 years.
Wow.
So it's a significant condition.
So he was at that 50%?
Well, he was describing kind of a leaky valve. Yeah,
Yeah.
absolutely. The initial episode was his aortic aneurysm, and then the second go around, it sounds like that valve was insufficient, where it may open okay, but it doesn't close.
Right.
And that blood just kind of cycles back.
Oh, man. And then what's incredible to a lot of people who aren't familiar with heart procedures is that Sean received a heart valve without major surgery at all. When you hear something happening with the heart, as a layperson, you picture someone sawing you open and cutting open your chest, and you went through, or Dr. Zorn rather, went through his groin. Can you talk about how common that is to treat the heart just through the groin?
Yeah, so actually, Dr. Zorn and I partner in this quite a bit. So I would say if you go back 10 years ago, a majority of these operations were open, right? So they would be the traditional open sternotomy, aortic valve replacement. In the last 5 to 6 years, it's really been a paradigm shift. So I bet a majority, 90%, we actually replace from the leg. We have a team, and it's called a transcatheter-based aortic valve replacement. So the analogy in my mind, it's like a stent that we put inside the artery. So a lot of times it's a valve mounted on a balloon. We go across the aortic valve, blow up the balloon, valve gets implanted, we're out.
So that's just been a change in the last 5-10 years, you said?
5-10 years. I bet our first transcatheter aortic valve replacement we did was probably about 13-14 years ago. But it was part of research, and now it's mainstream. So
then when you look to the future, if that much can change in a fairly short amount of time, what excites you most when you look ahead 10 years?
Oh, I mean, everything has just changed so much. So structural heart disease, so all the valves basically, mitral, tricuspid, aortic, pulmonic, we have minimally invasive approaches to address them all. I would say if I were to project forward, there are going to be a couple spaces that really are truly exciting. Heart failure transplant is going to be a big one. Transplant's just an amazing procedure. That team is incredible. They have devices that help support people till they get to transplant, and I think there's going to be a lot of innovation in that space. So we're going to be able to help support people get to transplant or manage them. So I think that's going to be an extremely exciting part going forward.
That sounds amazing, and it means such great things for patient care, and it makes it so much less dramatic when Sean hears you're going to go through his groin rather than cut him open.
Yep.
Well, I want to go to some questions from our viewers because we're getting a lot of great questions. Anne wrote in, and Anne wants to know, Dr. Wiley, this is for you. What's the difference? You can swallow your coffee.
Okay.
What's the difference between heart disease and heart failure, and does heart disease always lead to heart failure?
Yeah, not necessarily. I would say heart disease is kind of a comprehensive term for a lot of different things. And when I think of heart disease, I'm probably thinking more of coronary artery disease or blocked arteries in the heart. So if we can get aggressive, manage your cholesterol, manage the individual, prevent a heart attack, it doesn't lead to heart failure. Heart failure kind of is more the end stage of the process where the heart's not working like it should. So it's not pumping as much blood as it should, or you have a valve that's leaky. That's creating an inefficient heart. So heart failure is more of a congestion issue. Heart disease is more the process that gets you there.
A question for Carol. Sally wants to know, Carol, if you ever got to have contact or meet the family of your donor.
I have not because of HIPAA. However, a very dear friend of mine recommended that I write my journey, which I've been working on and should make myself finish it up, and then I can send it to back to my transplant team at KU, and then they can send it onto this woman's family.
Oh, that's so nice. So you'll be able to tell them how much it means to you and how you're doing now.
Yeah, I do every day, and every day I thank her.
I have a question from Leslie. This is for Sean and Carol. Sean, I'll start with you. Have you made any big changes since your procedure?
Yeah, great question. I actually have. I'm way more focused on like my health in terms of just overall, and the KU team, the heart team as a whole, has just been incredibly tremendously helpful at getting me to make sure I'm going in and having my lab work done, and I've changed how I function with my day-to-day activities and with all the things I do. I monitor my blood pressure now, which I never did before, and I just pay attention to all the little things to make sure that I'm doing as good as I can, and taking my medicine like I'm supposed to. I initially fought that whole concept of being on a cholesterol med. I've never had high cholesterol, and I don't, and KU's process is whether you do or you don't, we're going to cut that number in half, and that's been helpful because I don't have any blocked arteries. I'm in good shape, and life changes have been a key part of this for me.
And Carol, I see you nodding your head yes as Sean was talking.
I would echo Sean's remarks about the team. Our cardiac team has been just phenomenal. They answer any questions that we have or guide us and look out for us. I still remember when I checked in happened to be 3 years and 5 months ago to the day, and Sarah said that they would follow us for life, and that's huge. But I just maintain my exercise and take my medicines every day. So I'm I feel I continue to go down that path, but just am blessed by the team at KU.
Dr. Wiley, I have a question from our Facebook viewer, Yen Liang. He writes, does the dosage of anticoagulant medication required after a heart transplant or valve replacement gradually decrease over time?
So good question. There are different types of heart valves that we put in. There's one type of valve, class of valve, that we call a tissue valve or bioprosthetic valve. That typically does not require anticoagulation specifically for that valve. There's a second type of valve we call a mechanical valve, or it could be made of different types of metal alloy, or it's more mechanical. Those require a blood thinner. The only blood thinner indicated for a mechanical valve is something called warfarin or Coumadin, and that doesn't change over time. So we'll always have to have your blood thinned to a certain level, and we follow a number called an INR. But so I guess the long answer is no. If you have a mechanical valve, you'll always be on a blood thinner.
Okay.
If you have a tissue valve, just a baby aspirin.
Laura has a question for you. This is a really good question. She writes, I used to be a smoker, but I quit 2 years ago. Am I still at a higher risk for heart disease? Does the heart repair itself after you quit smoking?
Yeah, that's a great question. So, there's always a benefit to quitting smoking. I honestly just had this conversation with a patient yesterday who has been a lifelong smoker, and we kind of go through that. So you mitigate risk. You mitigate the risk of a heart attack or stroke by quitting smoking. The heart does have the ability in some instances to repair itself. The lungs do too. You can stabilize your lungs. So one of the bigger issues with smoking is lung disease, right? So emphysema. And if you continue to smoke, the lungs continue to decline. But if you stop, they can stabilize. Heart disease is similar. I mean, there's always a little bit of an increased risk, but I think we're able to mitigate that risk with good cardiac prevention. So quitting smoking, nothing better.
So what would be, and this is a common question that we got ahead of this episode, what would be your best advice to anyone watching to avoid or try to minimize the risk of heart disease? What can they do?
Yeah, I think just being proactive is probably the key.
Right.
We always do an incredible job. We put a lot of energy into treating sick people kind of when they already have the process, right? And listening to Sean, I mean, that's case in point. So how do you prevent getting there? So I think being proactive with a physician who's going to be advocating for cardiac prevention, it's cholesterol, diet, exercise, food as medicine. So those things early on, that's the way to do it. Once you have the blockages, then we're just trying to maintain.
But for Sean and Carol, Carol's was genetic.
Right.
Sean was a champion mountain biker and did everything right. So does it also come down to, I would imagine, listening to your body and then making that appointment, even if it's a pandemic?
Yeah,
Which,
absolutely.
Sean, we all did that. We all put things off. You just happen to have something really bad brewing.
Yeah, you got to listen to your body, and sometimes you got to listen to those around you. I think all of us kind of fall into watching the grass grow. So it's a very incremental change.
Right.
So it's like you don't really notice over time, but if your friend looks back, they notice a change over a year. So I think listening to your body, listening to those around you who are advocating for you, or your loved ones, or your friends, those are always helpful.
Because people notice the changes in you sometimes before you do. Which is just
most of the time.
Humanity, right?
Yeah.
I want to bring everybody in for some final thoughts, and I want to start with Carol. What would you want viewers watching to know the most?
To go in, find a cardiologist, and get a baseline. I tell people that all the time, especially like Alexis. You said at the beginning, 1 in 3 people die every year from some kind of heart related to disease or issue. So that would be that. And this comes from a friend of mine who's 100 years old. He says to exercise every day, and I couldn't agree with him more. So
I have to ask you, Carol, what's the sign behind you? Math is fun?
Oh, I teach a group of students in Zambia math twice a week. And so this is my classroom right here. And
in Zambia?
Yeah, over Zoom.
Oh, wow.
It's a long story, but I do that twice a week. Yeah.
I'm going to call you after the show. I'm going to get the long story because that's really cool.
Okay.
Sean, what would you like our viewers to know most?
I think it's important what Dr. Wiley said is and you said as well, is have your friends and family and keep your circle and make sure that you're checking in with people and your loved ones and know and listen to your body is probably the key to finding out what's going on with your health. And you have to advocate for yourself in that moment and go after and find a great cardiology team like you guys have at KU, because they saved my life twice.
That must feel pretty good to hear.
Yeah.
As the chief of cardiology here, what are your final thoughts?
I always really appreciate being able to hear some of the stories and just kind of reflect back. We have such an amazing team, and honestly, I always feel truly blessed to be a part of this organization with these cardiologists. We have just an incredible group of cardiologists, and so it's always really energizing to hear the stories. I think the message that I'd like to leave, obviously, is make sure to be proactive. You only get one body, you get one life, and some things are out of your control, but a lot of it's really in your power to stay healthy and stay active, and the longer you can do that, the better.
So speaking along those lines, when it comes to staying healthy, as a cardiologist, I always want to know this. Is there one food you refuse to eat where you're like, that is bad, I'm never going to eat that?
Let's see. I'm trying to think through that one now that you asked me that.
Or what's your guilty pleasure? If you everything in moderation, I get it, but
I like Espinaca cheese dip.
Okay, is that good for your heart or bad for your heart?
No, that's terrible for you. And there are times where I eat Espinaca cheese dip, and it's
you just work
really
out a little
bad.
more the next day.
I do the next day. Yeah.
Is there any food that's just awful for you, where you see
hot dogs?
Hot dogs.
Yeah, I would say if somebody offers you like a bison hot dog or a hot dog that's just fully loaded with sodium, that's probably not the best option. Yeah.
Okay.
Yep.
That's too bad. Love hot dogs. We're here with our viewers, though, to help you find some heart healthier recipes to get you through the fall. We have a great one just in time for tailgating. This is a recipe for loaded sweet potato bites. It's a heart healthier take on the classic potato skin, so you still can't eat the whole tray, but it is healthier. We have the recipe on your screen, but you can also take your phone, scan the QR code. That will bring the recipe right to your phone, along with plenty of other recipes to get you started on creating more heart-healthy meals and more tailgating snacks that are better than the sodium-loaded hot dog that Dr. Wiley's warning us about that we had last weekend.
Yeah.
Glad I didn't interview before last weekend. We've talked a lot about preventing heart disease during this episode, but how many of you know your risk of developing it? Right now, you can find out your risk for heart disease by answering a few simple questions. There is this quiz on our website, and this is a different QR code that's up now. So scan this QR code on your screen. It will take you right to the quiz. It's an excellent quiz, so we encourage everybody to take it. And now, Dr. Wiley, we're not done with you.
Oh.
We know you do incredible things here for your patients at the health system, but people always want to know, what are our doctors like outside of work?
Now for a secret look into the guardians of healthcare at the University of Kansas Health System. Let's go behind the mask.
Dr. Wiley, we have talked about your beekeeping. You are an amateur beekeeper. You're starting to blush and fidget. Don't worry, we don't have the beekeeping pictures this time.
Okay, good. That's good.
However, you have a pretty awesome family buzzing around at home. Tell us about these pictures and where you guys were.
We do. I got an amazing family.
Tell us their names, who we're looking at.
So on the right-hand side, that's my daughter, Callie. She is a senior down at Arkansas. The little guy behind with the hat, that's Henry. He's a senior in high school. And then the mustachio on the far left, that's Tom. He's a junior over at KU. Then there's my wife, Cindy. She's got the glasses on. This picture, this was our summer trip. So we like to be an active family, like to hike. And we loaded up a camper van, and there's the camper van. And we had the three, I call them kids, but they're adults now,
right.
Shoved in the back of this thing with their mountain bikes in the back, and kind of did a big Colorado circle, doing some mountain biking, doing some hiking, and had a great time.
You all slept in the van?
No.
The camper van? Oh, I was going to say, that's tight quarters.
So we did a little bit of camping, and so somebody was in a hammock, 2 people were in a tent, and then 2 people were in the camper van.
Who slept in the hammock? That's really hard on your back. Was it one of the young ones?
Honestly, my daughter did it one night.
She was like a champion.
One night, she was all about it. So
we have one more picture of you. Well, we have a couple more. Okay, this is a group picture from Treads and Threads, the Black Tie Gala and fundraiser. This is awesome that you guys were there. The whole cardiology unit was there. Over the past 20 years, Treads and Threads has raised more than $17 million. But Dr. Wiley, I want to ask you about your outfit. I mean, who are you wearing? Who's the designer?
I have no idea. I shop about once every 5 years. It was so it was supposed to be a blue theme,
right?
And I don't really have too many like blue ties or anything. And
I heard black tie.
It's a black tie, yeah. But
you
that's
put a twist on it?
It's a KU football jersey.
Oh, nice.
And then I thought I'd go white and black. Go big, right?
Very nice. You've got some sort of James Bond pose going there.
I don't know what that was.
it was excellent for us. Thank you so much for making time to join us. I know you've got to go treat patients. We are so appreciative of Carol and of Sean. Thank you for sharing your journeys with us. Coming up next week on All Things Heart.
Looking back now, it helped me feel strong. It helped me feel like I had control over something.
On the next All Things Heart, she took up a new passion, and doctors say it helped save her life. That's next Thursday at 8 a.m. Thanks.
Coming up tomorrow on the Morning Medical Update. From a troubled hospital in 1998 to a destination for healthcare today, the University of Kansas Health System has been through an incredible evolution. I'm Jessica Lovell. On the next Morning Medical Update, we reflect on the health system's history as we celebrate 25 years.